Some of the coronavirus story we're following this morning. Canada has recorded a 10th case of COVID-19, presumptive at this point. A woman arriving in Ontario went to a hospital with a cough after she came back to Canada from China on Friday. She's now at home in self-isolation with mild symptoms. We're going to be getting a news conference from Ontario health officials later this morning. New cases and deaths associated with the coronavirus continue to climb right around the world. China, of course, still with the vast majority of cases, now over 79,000. And outside of China, we're talking about more than 1,700 cases in 33 countries. South Korea, a big flashpoint, on red alert with more than 830 infections. That surpasses the Diamond Princess as the largest cluster outside China. Iran with now over 60 cases, but there are reports that number is much higher. We're hearing about 50 deaths in one city today. And Italy, we had that report from Megan Williams in Rome, currently with more than 150 cases, 5 deaths reported today, and major efforts to crack down and contain the spread through Italy and on into Europe. Let's talk about all of this with Dr. Peter Daszak, an infectious disease expert, the president of EcoHealth Alliance. We've talked to him previously. He's been credited with identifying the origins of SARS. His work has been key in predicting the global impact of emerging diseases. He was at that WHO conference in Geneva earlier this month where we talked about the latest science coming out of that. And he's in New York this morning joining us again. And we're happy to welcome you back to the program, Dr. Daszak. Thanks for being here.
My pleasure, Heather.
I have been looking at a number of headlines and reports this morning. One included citing the WHO director saying the window of opportunity is narrowing to halt the progress of COVID-19. Essentially, that experts are saying we're reaching a tipping point in this outbreak. What is your assessment?
Well, I think that's exactly right. We're at the point where I wouldn't be surprised if WHO called this a pandemic this week or next week. We've got multiple countries infected with community transmission in those countries. That's really the definition of a pandemic on different continents.
So they've called a news conference for this morning, 9:30. Is that something you might hear or might expect to hear from them today?
I think we'll either hear that they're calling it a pandemic or an explanation as to what needs to happen for it to become a pandemic. But look, this is all semantics right now. We've got a serious situation on the planet with an outbreak that's spreading, and we need to do something pretty drastically right now.
I'm going to come back to that point, but just to be clear, what again are the indicators that they will be looking at, that you fellow scientists are going to be looking at to determine if would this be disease X, this is pandemic?
Oh, for sure this is disease X. The definition of a pandemic is multiple countries infected on different continents and a self-sustaining outbreak. In other words, there is a continued transmission in multiple countries on 2 different continents. I think we're more or less at that point now, especially with the Iran and the Italian situation.
So as you look at this spread, as I mentioned, into 33 countries and more than 1,700 cases now outside of China, and increasingly these are cases where there is no direct link to China or travel to China, what is the biggest concern for you?
Well, that concern is that there are multiple more cases out there that we don't know about. So when we hear about them maybe, and it's unclear how many deaths have been in Iran, but if there are 50 deaths, that suggests, 3% mortality. We've got hundreds of cases that haven't yet been found. If we don't find those cases quickly, bring them into hospitals, quarantine the people, they're going to continue spreading this virus. And once it starts to leak across borders to other countries, then you see other outbreaks. And that's really what happens in a pandemic. We still have that window of opportunity, but we have to really act quickly right now.
And act quickly doing what? Because as you look at what most countries have been doing so far, it's been that strategy of containment. I think it raises questions whether that strategy is working.
Well, we think that the containment in China has given us a few extra days early on in the outbreak as they blocked travel around the Lunar New Year, maybe a few weeks as a global pandemic to hold this back. So containment does work to some extent, but of course, if you continue that containment, you actually block the ability to fight an outbreak because we need open communication, we need healthcare workers to move around from one country to another, and we need the supply chain to keep us supplied with critical control equipment like masks, syringes, and disinfectants, those sort of things.
So those are the things that really need to be done in the short term, this narrow window of opportunity, if we want to stop its spread further. You know, what we were talking on the verge of the WHO declaring coronavirus a global health emergency. And there was all sorts of talk about what it would take to make that designation, what it would mean if the WHO did deliver that designation, the kinds of resources and systems that they would be able to tap into. If they say pandemic, what does that change?
Well, I think what it does is it changes in the public's mind what we're dealing with now. And I think that already what we've seen with an outbreak in Italy, for instance, where we've seen pretty draconian measures to lock down villages where there are people infected. We need to expect that in our own countries. And I think what really we learn from calling this a pandemic is what we, the public, need to do to get ready for that. And that's to stay calm, to think logically, and start thinking about what we should be doing. If we've got medicines that we need that are critical, making sure we've got enough of those to last a few weeks, and just generally getting ready to how we'll deal with this. If 10% of the people aren't in work, how we're going to continue opening our businesses. You know, looking at our healthcare workers, are we protecting them? Have we got enough equipment and supplies to keep them operational? Have we got enough hospital beds? Have we got places that we can start to put lots of patients if the hospitals get overwhelmed? These are the sorts of things that I think healthcare professionals are doing right now in multiple countries.
So they're making special preparations. We, the public, though, need to get mentally prepared for this as well.
That's right.
We're talking about where the coronavirus has spread into these 33 countries. What we're not talking about yet is Africa. We're not really talking about India. We're not talking about much of the developing world. How much of that part of the world is of concern to you?
Well, it's a huge concern to me and everybody. I mean, if you look at what happened in Iran, we still don't know for sure how many cases are out. And Iran's quite a wealthy country compared to some others. This is an issue about resources. Countries that have less funds, less resources, are going to have less doctors and less quarantine capacity. So they're going to find people infected slower, they're going to quarantine them slower, and the virus is going to have a chance to spread. So we expect the virus to be able to spread better in countries that are low capacity. And that includes sub-Saharan Africa, Indonesia, India, countries around the world with a much lower GDP and very dense populations. They're going to be at risk.
We've certainly heard WHO officials express their concern, too, as they watch that for any signs of spread into those parts of the world. We did hear from the Director General of the WHO saying this could even be messy, you know, looking to a worst-case scenario. He didn't really describe that, but he did say it could be messy. Are you at this point, Dr. Daszak, still optimistic, or are you veering to pessimistic? What would messy look like for you?
Well, I'm always optimistic. I mean, look, let's put this into context. Right now, there are a few 100,000 at most people infected on a planet of many billions of people. The mortality rate is 3%, not 10%. So let's stay positive and start to fight this. And I think that as we stay optimistic, we stay able and ready and willing to fight. But I think when we look at what could happen in a pandemic, the messy things are, look, are the public going to accept these draconian quarantine measures and being told you're not allowed to leave your house, even if you're not infected? Are we ready for that yet? I think that it's incumbent on health authorities around the world to start telling their public what to expect and how to get ready mentally, as you say, for what's going to happen. Because the messy part is when people don't accept that and we start to see riots, as we saw with Ebola and other diseases, as things become short, short supplies in shops, and people start to fight over that. That's where it becomes a real problem. China's dealt with this incredibly well, considering the chaos that they're working with right now. But we have to look at what that would mean if that sort of level of infection would happen in our own countries.
That's a sobering portrait, but an important one to consider. And Dr. Daszak, I thank you for bringing it to us today.
My pleasure, Heather. Stay safe.
Yes.
And keep positive.
Indeed, keep positive. Dr. Peter Daszak in New York this morning.